Now, let's assume Britain tightens up the standard saying, hey, look, we've got a lot of questionable Muslim doctors in our ranks here. We're going to at least slow down on the visas allowing them in here. They will then go elsewhere. Where else likely do they go?
Well, you've got shortages in doctors and nurses basically wherever you have state-run health care. The United States, we import a lot of physicians, about a quarter, but in the UK they import about half, nearly half of their physicians and nurses from abroad. So they're going to go to other state-run enterprises, they're going to go to other places in Europe. This is a real vulnerability, and Neil, it's not just a matter of them supplying, the Muslim world supplying physicians and Europe needing them. I think you also have a situation where a state-run healthcare enterprise is bureaucratic, and I think the terrorists have shown over and over again, whether it's dealing with INS or whether it's dealing with airport security, they're very good at gaming the system with bureaucracies. They're very good at figuring out how to get around bureaucracies.
Well, you also have the advantage in a bureaucracy, Jared, I think you pointed this out, of becoming invisible, right? Whereas if you were to join a U.S. medical practice, or even as some internists do, just join an operation, let's say, in Missouri or Kansas,
right.
You would stand out for your religious views or being an oddity, period. There's not a racial comment, but it just is. So,
yeah.
So that's what is distinctive about, in a national system, it's more diluted, right?
Yeah, yeah. Think about your doctor. I'll think about my doctor. Doctors in America tend to, sort of cluster together in these practices with 3 or 5 or 6 or 7, maybe a dozen partners. It's a partnership. Legally, it's organized as a partnership. Yes, they serve in a hospital, but that's not their main source of income. And if one of your guys is a jihadist, if one of your doctors is spending all the time reading, online reading Osama bin Laden fatwas, somebody's going to notice that. But the National Health Service is more like the post office. There's a lot of anonymity. It's easy to hide in the bureaucracy. And more to the point, if you're a physician and you're in partnership with another physician and they turn out to be a terrorist, the practice is blown. Yeah, I mean, there's severe economic consequences for you. But in a big bureaucracy, that's not the case.
So the fact that we might be looking to go this way in the United States, you're saying one of the potential consequences, without judging national health care one way or the other,
right,
is that this could happen, that we have to be at least aware of the distinct possibility in such a system.
Yes.
We would have to recruit outside doctors, and where we're getting the most of them these days seems to be from the Muslim world.